Better health and welfare for all. That's the goal for the Inkatha Freedom Party's two-day health summit or welfare summit. It drew experts from various sectors to discuss some of the key issues facing the country's health sector. Among these are the national health insurance, South Africa's water challenges, and government's failure to deliver essential welfare services. IFP Chief Whip Narend Singh joins us this afternoon to unpack the summit and some of the potential solutions to the many issues that face the space. Thank you very much, Mr. Singh, for joining us this afternoon. Let's start about who are the different stakeholders that attended this particular summit, and what were some of the key themes that were addressed by the different stakeholders?
Well, good afternoon, Rafiwa, and good afternoon to the viewers. Thank you for giving us an opportunity. Yes, we are having this two-day summit on health and welfare, and we were very pleased to have high-caliber panelists participate in the summit. We've had representatives of the Institute of Race Relations. We have had representatives from the South African Medical Association, representatives from a Health Funders Association, a representative of government, Dr. Nicholas Crisp, and amongst others, and then Dr. Anushka Kuvadia, who is an expert and has been dealing with health issues in about 40 countries around the world.
And what were some of the big challenges that were identified as the priorities that need to be worked on in the coming years?
Well, the main subject was the NHI, which I think South Africa is aware of and the viewers are aware of. The IFP is not opposed to universal healthcare. We believe that there must be a time when every citizen of our society needs to have quality healthcare, and that is something that's eluding them at this moment in time. But we don't believe that the NHI is being piloted at the right moment, because our public healthcare system leaves a lot to be desired. And the IFP objected to the passage of the bill on the National Assembly, not on the basis of us not agreeing to universal healthcare, but on the basis that the governance mechanisms that are contained in the bill are such that government does not give us any hope that they will be able to manage these funds and manage healthcare appropriately in South Africa.
I mean, the national healthcare aside, or the NHI aside, Mr. Singh, as the IFP and related stakeholders, what would you do to deal with the immediate issues that you've just described to us now of the provision of basic healthcare services in South Africa? We've seen the infrastructure at many of our healthcare facilities, the lack of resources, and critical skills lacking there as well. So what would the immediate action be taken to kind of remedy those issues so that we can have an appropriate integration of the NHI?
Well, I think the first thing, as you've said, is infrastructure, ensuring that our infrastructure is appropriate and there's a conducive environment. Now, when you go to many of the private healthcare clinics and hospitals, people complain about the lack of basic infrastructure. I mean, you also reported on your channel about babies being put into cardboard boxes. We saw what happened during COVID, where although there were hundreds of millions of rand allocated to infrastructure, there was a lot of corruption. And a lot of money went down the drain, to say so proverbially. So we need to sort out our infrastructure, but we also need to encourage the healthcare management of doctors and nurses. They need to be treated in a proper manner. They need not to work 24-hour shifts. We talk about a shortage of doctors in South Africa, yet there are many doctors who've qualified, gone through their board exams and their community services, and yet they're unable to get jobs in the public sector. And we ask ourselves why, when we are told ad nauseum that there's a shortage of medical professional and shortage of doctors.
I mean, was that discussed, that why component of why is it that you've got so many professionals sitting at home unable to enter the system, and yet you've got those who studied abroad, Cuba, for example, who are immediately placed into positions? Why is that the situation? Was this question ventilated at all?
Not ventilated, but it's a subject that's close to my heart because I've been working with organizations that represent those students who, through no fault of their own, go abroad to study medicine. And they go to accredited institutions outside of the country, study there, come back, write their board exams, and then, they don't get admission into our hospitals. But Rafiwa, I was in Cuba a few years ago, and with the parliamentary delegation led by Speaker Mbeta. And I insisted that we engage with South Africans who are studying at medical institutions in Cuba. And they were also complaining about the fact that even when they complete their degrees there, they have to come back here and study at a medical institution in South Africa, and they find it very difficult to get admitted. So I think the whole system needs to be re-looked at. We need to encourage our doctors and professionals and nurses to remain in our country because we need our people to have the best health care service that is possible.
Was there any discussion around the water crisis that we have in many parts of the country, as well as the electricity crisis, and how those issues can be dealt with so that the best kind of healthcare can be afforded to those residing in the country?
Yes, water has been another topic that we engaged in today, and we were delighted to have a representative of the Director General, who's Dr. Sean Phillips, with us, Mr. Ashley Stark, who heads the provincial sector, KZN Province Department of Water. And then we were delighted to have Dr. Turton, who is an expert on water matters. And lastly, but not least, Professor Mike Muller, who was the former Director General of Water and who's now involved in many countries around the world and on WHO and other organizations talking about water-related issues. And I think what was stark was the fact that in terms of quality of water and sanitation, they made a presentation to us on what was called the green dot. And, it's terrible for us to know that water and sanitation are not being provided as promised to the people of South Africa. In fact, yesterday we had a medical doctor on our panel, I won't mention his name, who said that he comes from the area of Flagstaff in the now Eastern Cape. And this government promised water to all in 1994. But to date, his family have to still go to streams and rivers to collect water. And he used that as an analogy to say, what confidence will we have in this government to be able to manage NHI properly? So in terms of water, I think the challenges evolved around infrastructure, the lack of infrastructure, and although we noted that there are a number of initiatives that are on the way, but the lack of infrastructure, the lack of maintenance of existing infrastructure, which leads to massive water leaks, and we find that all over. But I think another interesting issue was the vandalism issue. And the vandalism issue, it seems, is being orchestrated by certain sectors within our society, not only vandalism of existing infrastructure, but also where there are new projects. There's one project in the Mkomazi area on the south coast of KwaZulu-Natal, where incidentally I come from. It's a 26 billion rand project. And I have personally seen how what I would call the mafia operate in that area, wanting tenders and exploiting the situation there. And for weeks on ends, projects have had to stop because of the interference of the so-called mafia. So I think it requires a comprehensive discussion. It requires us to get community cooperation in terms of vandalism, because the same, I think, can be said of electricity, where there's a lot of vandalism, stealing of cables, etc. So I think with water, it's taken far too long for this government, a democratic government, to be able to provide water to all the citizens of our country. Yes, we agree as the IFP and as a panelist that there's been a lot of progress, but a lot more could have been done and could have been done better.
Thank you very much for those insights, Mr. Narend Singh, Member of Parliament there and the Chief Whip of the IFP in the National Assembly, joining us this afternoon to break down some of the key themes that were looked at the Health and Welfare Summit held yesterday and, of course, today.